when the world's first clinically authorised coronavirus vaccine was given in Coventry Hospital. We've been engaged, all of us, in a race between the virus and the vaccine. As a nation, we've taken some huge strides forward, and we can make careful further progress today, and we must remain vigilant. I can report to the House that there are now fewer than 1,000 people in hospital in the United Kingdom with coronavirus, and the average number of daily deaths is now 9. This progress means we're able to take step 3 in our roadmap today, carefully easing some of the restrictions that we've all endured. People have missed the things that make life worth living, businesses have endured hardship, and everybody has made sacrifices. And while we can take this step today, we must be humble in the face of this virus. We've all learned over the past year that in a pandemic, we must look not just at where we are today, but where the evidence shows we may be in weeks and months down the track. The vaccination programme can give us confidence, but we must be alert to new variants that could jeopardise the advances that we've made. Today, Mr. Speaker, I'd like to update the House on the work we're doing to tackle variants of concern. In particular, variant B1617.2, which is the variant of concern first identified in India, so that we can protect the progress that we've worked so hard to achieve. There's now 2,323 confirmed cases of B1617.2 in the UK. 483 of these cases have been seen in Bolton and Blackburn with Darwen, where it's now the dominant strain. Cases there have doubled in the last week and are rising in all age groups. In Blackburn, hospitalisations are stable, with 8 people currently in hospital with COVID. And in Bolton, 19 people are now in hospital with coronavirus, the majority of whom are eligible for a vaccine but haven't yet had a vaccine. This shows the new variant is not tending to penetrate into older, vaccinated groups, and it underlines again the importance of getting the jab, especially, but not only, amongst the vulnerable age groups. Madam Deputy Speaker, Mr. Deputy Speaker, Mr. Deputy Speaker, in Bolton and Blackburn, we've taken the approach that worked in South London against the South African variant. We've surged in our rapid response team, 100 people so far, who this weekend visited around 35,000 people to distribute and collect tests. We've installed 6 new testing units, we've brought in over 50 new vaccinators and set up 2 new vaccination centres, as well as extending opening hours and capacity at our existing sites. In Bolton, we've quadrupled the rate of vaccination. We carried out 6,200 vaccinations over this weekend, and it's brilliant to see so many people from the most vulnerable groups coming forward to get the protection, whether it's coming forward to get the first jab or coming forward to get their second jab. All in all, this is the biggest surge of resources into any specific local area we've seen during the pandemic so far. It's been coordinated by Dr. Jenny Harries, the Chief Executive of the new UK Health Security Agency, drawing on all the health capabilities locally and nationally that we've built in the last year. I want to thank everyone who's working so hard to make it happen, including everyone at the 2 local authorities, the rapid response team, all the volunteers, including from St John's Ambulance, and most importantly, the people of Bolton and Blackburn for the community spirit they're showing. It's been really heartening, I'm sure the whole House will agree, to see the videos that have been published over the weekend of people queuing up to get the jab. And to anyone who feels hesitant, not just in Bolton or Blackburn, but to anyone who feels hesitant about getting the vaccine right across the country, just look at what's happening in Bolton Hospital, where the majority of people in hospital with coronavirus were eligible for the jab but have chosen not yet to have the jab and have ended up in hospital, some of them in intensive care. Vaccines save lives, Mr. Deputy Speaker. They protect you, they protect your loved ones, and they will help us all get out of this pandemic. Mr. Deputy Speaker, this isn't just about Bolton and Blackburn. There are now 86 local authorities where there are 5 or more confirmed cases. The next biggest case of concern is Bedford, where we are surging testing. And I would urge everybody in Bedford to exercise caution and engage in testing where it is available. Mr. Speaker, Deputy Speaker, I also want to tell the House the latest scientific assessment of this variant. The early evidence suggests that B1617.2 is more transmissible than the previously dominant B1117 variant. We do not yet know to what extent it's more transmissible. And while we also don't have the complete picture on the impact of the vaccine, the early laboratory data from Oxford University corroborates the provisional evidence from Bolton Hospital and the initial observational data from India that vaccines are effective against this variant. This, of course, is reassuring, but the higher transmission poses a real risk. All this supports our overriding strategy, which is gradually and cautiously to replace the restrictions on freedom with the protections from the vaccines. The data suggests that the vaccine has already saved over 12,000 lives and prevented over 33,000 people from being hospitalised. And we're protecting people at a very rapid pace. Last week was the biggest week of vaccinations since the end of March. 36 million people have now had a first dose, and yesterday we reached the milestone of 20 million people having had their second dose across the UK. And I'm delighted to see the figures released by YouGov today, which show that the UK has the highest vaccination enthusiasm in the world, with 90% of people saying that they have had or will have the jab. This was no accident. We began planning the campaign for vaccine uptake a year ago, and I want to thank the huge range of people involved in promoting the benefits of vaccination, from Her Majesty the Queen to Sir Elton John and Harry Redknapp and Sir Lenny Henry, Holly Willoughby and Lydia West, and many, many others. Our campaign has been based on positivity and science, and I'm grateful to everyone, including so many members of this House from all sides who have played their part. From tomorrow, I can confirm that we will be inviting people aged 37 to come forward before expanding this further later in the week. It's been brilliant to see the enthusiasm people have had when they've been invited to come forward. And we want to make it as easy as possible for people to show that they've had the protection that the vaccine provides. And I'm delighted to say that as of today, people can now demonstrate whether they've had their jab quickly and simply through the NHS app. Mr. Deputy Speaker, since January, we've been following a dosing interval of 12 weeks for second doses. Because the extra protection you get from a second dose, particularly amongst those most likely to end up in hospital or dying, it is incredibly important that everyone comes forward for that second dose at the right moment. The approach we've taken aims to give the most vulnerable the strongest possible protection against the virus. So since January, that's meant getting the first dose to as many people as possible, as quickly as possible. The research shows that this approach has saved around 12,000 lives. Now it's important to accelerate the second doses of all those most vulnerable to ending up in hospital or dying. So our vaccination strategy for all parts of the UK, including the areas of surge vaccination, will stick by the clinical advice set out by the JCVI. First, prioritise anyone over 50 who has not yet been vaccinated. Next, second doses to those over 50 are vital, which will now be done at a schedule of 8 weeks. Then follow the cohorts in priority order and the age groups as we open them. This clinically approved approach is the best way to save the most lives, rather than jumping ahead with first doses for younger people. While the JCVI, of course, keeps this clinical advice under constant review, we are clear that their advice is the best way to protect those most in need of protection and so save as many lives as we can. The NHS will be reiterating this advice to all vaccination centres and all directors of public health, and I'm very, very grateful to everyone in the NHS, in local authorities and in the whole system supporting this vaccination programme for following it. Mr. Deputy Speaker, today's opening and step 3 marks an important step on our road to recovery. We must proceed with caution and care and bear down on the virus in whatever form it attacks us. so that in this race between the vaccine and the virus, it's our humanity, our science and our ingenuity that will prevail. And I commend this statement to the House.
Yeah.
Jonathan Ashworth.
Thank you, Mr Deputy Speaker, and I thank, of course, the Secretary of State for advance sight of his statement. And may I just at the start, Mr Deputy Speaker, congratulate Leicester City football team on winning the FA Cup on Saturday. The winning goal from Tielemans was one of dreams, and Leicester City fans boast that foxes never give up. And nor do I, Mr Deputy Speaker. So, turning today to the matters before us. Yesterday, he warned on the television that the B1617.2 variant could spread like wildfire amongst the unvaccinated. But does he accept we could have avoided this? Our borders have been about as secure as a sieve. The delay in adding India to the red list surely now stands as a catastrophic misstep. Now, 1 month ago in this House, I urged him to act quickly in response to this variant. The Sanger Institute data today shows rapid increase in this variant, 30% of all sequenced cases in the UK, and that excludes cases from travel and surge testing. Alarm bells should be ringing, because while he offers reassurance that vaccines are effective, we've also heard from Professor Anthony Harden of the JCVI recently, who has warned us that vaccines are almost certainly less effective at reducing transmission of this variant. Now, I entirely appreciate that when questioned, I suspect he won't be able to give a cast-iron assurance about opening up on June 21st. And I'm not going to try and push him into a corner. We all understand that we're dealing with uncertainties. We've got to be grown up about these things. But we do need a plan now to contain this variant urgently. He's said to be considering local lockdowns. Well, I speak, as he knows, as a resident of long lockdown Leicester. So before he takes out his mallet to try to whack moles again, can I suggest a number of things he tries first? Firstly, can he consider surge vaccination in all hotspot areas and go hell for leather to roll out vaccination to everyone? I was listening carefully to what he said about vaccination increases in Bolton, and I hope that also includes Blackburn. Is he saying that everyone over 18 in those areas will now be eligible for vaccination? As he knows, that's something the public health directors on the ground have been calling for. I hope we can listen to him. But he knows, because we've had these debates before in the House, that even if we drive up vaccination to as high as it possibly can go amongst adults, there are still around 20% of the wider population, i.e. children, who remain unvaccinated, which means the virus can still spread. The CDC in the US is moving to vaccinate children, so can he update us on what progress he is making on that front here? And with respect to children, can he also just clarify to the House that he will know today that in many secondary schools mask wearing is no longer necessary? Can he just assure us that he thinks that is the right response in light of the data that he's been unveiling today? Secondly, he's announced extra surge testing, but he knows by now that surge testing must be backed up by proper sick pay and decent isolation support. That should have been fixed in the Queen's speech last week. Thirdly, more venues are opening up today, and in many of those venues they'll be spending a lot of time disinfecting surfaces like we do in here, for example, which is good and important. But we know so much more about this virus now. We know about airborne spread of the virus. So why aren't we supporting venues more with ventilation? What are we doing in supermarkets, shopping centres, larger venues where air circulates around the building? What are we doing to help them put in place COVID-secure air filtration systems? Fourthly, what he said about the NHS and the uptake of beds is welcome. But NHS staff, as he knows, are exhausted and they will be fearing another surge. So can he tell us what modelling has been shared with NHS leaders and what they are doing to prepare for any surge in admissions? And finally, Mr Deputy Speaker, the surge in this variant reminds us that we are not safe until everyone is safe. That is not a slogan, it's a fact. 3.3 million lives have been lost globally to this virus, and Dr Tedros from the WHO warns that we're on track for the second year of this pandemic to be far more deadly than the first. Only 0.3% of vaccine supply is going to low-income countries. Trickle-down vaccination is not an effective strategy for fighting this deadly virus. Not only do we have a moral responsibility to play our part internationally, it also reduces the risk of new variants bouncing back at us and setting us back. So at this critical time, when we need to work internationally to defeat this virus, why are we the only G7 nation cutting our aid budgets? How can he defend cutting our contribution to vital science and research projects? And given the total silence from the government on President Biden's support for the temporary lifting of patent protections to increase vaccine production, should we assume that this government does not agree with President Biden?
Secretary of State.
Right, thank you very much, Mr. Speaker. If I address the substantive questions that he asked, the first question was about the surging of both vaccines and testing into these hotspots. And we've seen in South London earlier in the month and last month that this sort of surge testing can work. We had an outbreak of the South African variant in South London. We put in over 200,000 tests, and we effectively managed to contain that outbreak. That is the approach that we're taking in Bolton and in Blackburn, and we will also take that approach if we see a further spread in other areas of the country. It's something that we have been working very hard on to ensure that we have that capacity and that we can do that effectively. And we do that, of course, hand in glove with the local authorities in question who know the communities on the ground. We're also making sure that we have the vaccines available. But I want to be absolutely crystal clear about the approach to vaccination, because he asked about vaccinating all over 18s in Bolton and in Blackburn. That is not our approach. I have looked into it in great detail and we have taken clinical advice. The approach is to make sure we get as many second vaccinations done as possible, as many first vaccinations amongst the vulnerable groups, and then as many vaccinations as possible for those eligible groups who are under the age of 50. And the reason that we've taken this approach is because that is what is most likely to save most lives. That second jab is absolutely vital. And of course, the first jab for anybody over 50 could be the difference between life and death. And so the very strong focus is to get the vaccine into to all those over 50s who have not yet taken the first jab. And I'm glad to say that there are reports from both Bolton and Blackburn that uptake amongst people who are eligible but haven't yet got the jab has increased since we saw the rise of the B.1.617.2 variant in those areas. I think because it's effective in proving to people that the jab really does work to protect you. That is what the data shows. He asked about children. I've been closely following the results of the clinical studies from Pfizer that show that the vaccine is safe and effective amongst children between the ages of 12 and 18. We have procured enough Pfizer to be able to use the Pfizer jab and offer it to children, should that be clinically approved here. But given that we're at the stage of opening tomorrow to people aged 37, there's some time to go until we'll reach to 18-year-olds. We're on track to meet the target of offering the vaccine to all those age 18 and above by the end of July. So we have a couple of months before we need to make and operationalise a decision, and we want to be very, very careful and sensitive around whether and how to offer the vaccine to children. He asked about wider measures which are important. Ventilation, he mentioned, and we have put in place guidance for businesses in terms of strengthening the rules around ventilation, and that too is important. He did a bit of a Captain Hindsight act, I thought, on when it came to the Indian variant. He didn't seem to mention that we put India on the red list before this variant was deemed a variant even under investigation, let alone a variant of concern. And indeed, we stopped we put India on the red list before other countries like Germany and Canada stopped flights from India. We have a strong policy of restrictions at the border, and we will remain vigilant. The final thing I wanted to respond to was his point about the global moral responsibility to vaccinate everybody in the world. He's absolutely right that we have a global moral responsibility, and I would argue that the United Kingdom has done thus far and will do more than any other nation. It's not just about the huge sums that we've put into COVAX, but it's about the way that we've delivered the Oxford AstraZeneca vaccine around the world. As of this morning, there were 1.47 billion vaccines that have been delivered globally. 400 million of those have been the Oxford AstraZeneca vaccine, and AstraZeneca has charged a profit margin and a margin for intellectual property of 0. No charge for intellectual property, no profit for AstraZeneca. Costs, of course, need to be met, but we have taken nothing for the money that we've put in to the development of this. This is the biggest gift that this country could give to the world. 65% of those 400 million doses have been delivered into arms of people in low and middle income countries, including over 150 million in India. Of the COVAX facility, which is the biggest global effort to vaccinate in low and middle income countries, they have delivered 54 million vaccines so far. 53 million of those have been done with the Oxford AstraZeneca vaccine. This country can be hugely proud of the contribution we've made. It's far bigger so far than any other country, because we decided, and we took the view from the start, the UK approach, which is you don't need to change your IP rules, you don't need to change the law, we just get on and get this vaccine out to as many people around the world as possible at cost. Everybody in this House should be very, very proud of what AstraZeneca and Oxford University have done with the support of the UK government, and that is how we save lives around the world.
Jeremy Hunt.
Mr Deputy Speaker, many of these new variants come from abroad, so clarity on borders policy is essential. We know that the first wave, now we know, was largely seeded from people coming back from their spring holiday break in Italy, France and Spain. So could I ask him for absolute clarity on the amber list? Should my constituents in Farnham, Godalming and Hazelmere, or all of our constituents, go on holiday to countries on that amber list, even when it is no longer illegal?
Mr. Speaker, the answer is no. The official government advice is very clear that people should not travel to amber or red list countries or territories. People should not travel to amber list countries for a holiday. These lists of what's on the amber list, what's on the red list, and what's on the green list are kept under review based on the data that is assessed by the Joint Biosecurity Centre. Our priority is protecting the progress that we've made at home, and we will assess any new countries that might go onto the green list every 3 weeks, and of course constantly monitor to check that the countries on the green list remain safe. But if it isn't on the green list, then unless you have an exceptional reason, you shouldn't be travelling there.
Videolink. Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. COVID cases in India began to soar at the start of April. So why were Pakistan and Bangladesh added to the red list at that time, but not India? Was it because of the Prime Minister's planned trade visit? After finally adding India to the red list on the 19th of April, it didn't take effect until the 23rd. How many people arrived from India in those days trying to escape going into hotel quarantine? When I previously raised the issue of applying hotel quarantine to all travellers, the Secretary of State claimed the current system was protecting the UK. Does he now accept that the entry and community spread of the Indian variant shows this simply isn't the case, and that having a negative test doesn't rule out that travellers are carrying COVID? SAGE has stated that evidence shows the B1617.2 Indian variant is up to 50% more infectious than the Kent variant, and have advised that, as in Scotland, areas with rising cases should remain under COVID restrictions. The Indian variant has been doubling every week despite lockdown. So why is he ignoring sage advice and opening up areas like Bolton that have exponential growth? Thankfully, this variant doesn't show significant vaccine resistance, but he must know it isn't possible to outrun the virus through vaccination alone. With those up to 35 not eligible for surge vaccination, this leaves a large pool of unvaccinated people in whom the variant can spread. And even those who receive a vaccine in the coming weeks, it will take 2 to 3 weeks before they are protected. Does he not accept that this variant is in danger of surging and that without local travel restrictions will spread to other areas? While it's good news that fully vaccinated people aren't ending up in hospital, just letting it spread among young adults could allow the evolution of yet another UK variant.
Secretary of State.
Thank you, Mr. Deputy Speaker. I answered these questions in the response to the Honourable Gentleman. The truth is that when we put Pakistan on the red list, and indeed Bangladesh, the positivity of those arriving from Pakistan and Bangladesh was 3 times higher than from India. That's why we took those decisions. And of course, that decision was taken before the Indian variant became a variant under investigation, let alone a variant of concern. And it's striking that the Scottish government took a red list decision on India at the same time as we did in the UK government. So it's all very well to ask questions with hindsight, but you have to base decisions and policy on the evidence at the time. When it comes to how we're tackling this in the UK, she's quite right that it is good news, early news, but good news, that the vaccines do appear to be effective against the B.1.617.2 variant. And I'm obviously pleased about the evidence that we've seen, but we're vigilant about that. And I'm very glad that the approach that we're taking now in Bolton and in Blackburn worked in South London against the South African variant. We keep these things always under review, but I think as a first resort, surge testing, going door to door, making sure we find and seek out this virus wherever we can spot it, putting in the extra resources with the armed services who are supporting, and that is the right approach whilst we keep this under review. The numbers thus far nationally are still relatively low, and thankfully we have a very, very good surveillance operation across the UK so that we can spot these things early and take the action that we need.
Greg Clark.
Thank you very much indeed, Mr. Deputy Speaker. Does my right honourable friend agree with Sir Patrick Vallance, who told my committee that new variants will arise all the time and border restrictions will only slow, not prevent, those variants that originate overseas? So what level of vaccination protection do we need to get to in this country before he's in a position to rescind the rather strange advice is just given to our right honourable friend and allow people who've been tested 3 times and quarantined for 10 days to travel to places like France and Spain?
Typically, from my right honourable friend, he asked the most pertinent question, to which we do not know the answer. Because the level of vaccination that you need to be able to withstand the incursion of new variants, even that the vaccine will work against, does depend on their level of transmissibility, and we don't know the increased level of transmissibility over and above the B.1.17 previous main variant here in the UK, that was the variant that first was discovered, of course, in Kent. And therefore, this is an absolutely critical question, but unfortunately we don't know the answer to it yet.
Munira Wilson.
Thank you very much, Mr. Deputy Speaker. Having reached this tremendous milestone today, and given the sacrifices the British people have made through lockdown and the fantastic successes of the vaccination programme, Will the Secretary of State listen to his own colleague who said last week that with the new variant we must isolate every single case and its contact? So will he finally commit to paying people's wages to stay at home to self-isolate, providing practical support in terms of accommodation if necessary and support for dependents? Otherwise, we will only go backwards.
I'm afraid I don't agree with her characterisation of the situation, not least because the approach we're taking in Bolton did work effectively in South London, where we are piloting new approaches to ensuring that we can support people to isolate, and some of those pilots are taking place in some of the areas where we can see cases of B1617.2. We keep that under close scrutiny and close review to see what works effectively.
David Johnston.
Thank you, Mr. Deputy Speaker. Part of our fight against COVID, or indeed future viruses, is to improve our domestic vaccine manufacturing capability. To that end, the government's fast-tracking the Vaccines Manufacturing and Innovation Centre at Harwell in my constituency. I'll be visiting in a few weeks, but could my right honourable friend provide an update on the progress so far?
Yes, we're making significant progress with onshoring of vaccine capability. It's about developing the vaccine, as the team at Oxford did brilliantly, but also they're manufacturing it onshore. And boy, if there's one lesson that we've learned from this whole thing, it's that you can't just not care about where manufacturing happens. Having it onshore really, really matters for resilience, but also to make sure that it's close to the NHS so that we can learn, the whole supply chain can learn and constantly improve. So I'm delighted that we're pushing forward with the VMIC project in the same way that we've brought onshore manufacturing supply in Teesside, in Livingston in Scotland, and of course the fill and finish plants both in Wockart, in Wrexham, and in Barnard Castle and elsewhere. It's a big project, and it's frankly a big opportunity for life sciences in the UK to make sure that we can do all this onshore, because the pandemic, in my view, has shown that we need to.
Lydia Link. Jim Shannon.
Speaker, can I thank the Secretary of State for his statement and for his comprehensive answers as well. I know that the Secretary of State has regular discussions with the Northern Ireland Assembly Health Minister Robin Swan. There has been a surge in the mutant and Indian variants in Donegal in the Republic of Ireland and the maiden city, Londonderry, in Northern Ireland. So can the Northern Ireland Assembly Health Minister call upon the UK for expertise from Westminster to help assist, which I believe will show once again that we're always better together with the United Kingdom of Great Britain and Northern Ireland. Thank you.
I couldn't agree more with the honourable gentleman. The UK fights this together. There are, of course, outbreaks also in Moray and in Glasgow, and I've been talking to the Scottish Cabinet Secretary for Health about the action that's going on to tackle the outbreaks there, and I talk regularly, very frequently, with Robin Swan, who I think is doing an absolutely brilliant job with the health portfolio in Northern Ireland. But the fundamental point that the benefits of the United Kingdom working together are once more demonstrated by our ability to work together to tackle this variant.
The video link. Dr. Jamie Wallace.
Thank you, Mr. Deputy Speaker. More than 20 million people have now received their second dose of the vaccine, an achievement which demonstrates the phenomenal pace at which we are delivering the vaccine across the UK. Does my right honourable friend agree that this incredible milestone demonstrates what our union can achieve when we work together?
I just waxed lyrical about the value of Scotland and working with the UK government, and of Northern Ireland working with the UK government. And my honourable friend almost chastises me for not mentioning Wales. Of course, working with Wales is incredibly important. Look at the fill-finish plant in Wockart. The number of people who have been vaccinated in this country with a product that is manufactured in Wales, measures in the tens of millions, including myself. And we should all be very proud of that. And I look forward to working with my new Welsh counterpart, the Health Minister for Wales, and making sure that we use all capabilities across these islands to get us back onto the road to recovery.
Liz Twist.
Thank you, Mr Deputy Speaker. Today sees the long-anticipated lifting of many of the restrictions on our life and social life. At the same time, this strain of the virus reminds us that we need to be cautious in how we mix and how we hug our loved ones. It's important that we have clear messages about interaction. So will the Secretary of State ensure that government messages are clear and unambiguous and not mixed as at present?
It's really clear that we are removing restrictions. I'm delighted that we're able to remove restrictions. For instance, the absolute restrictions that were in place in terms of close physical contact, and rely more on people's personal responsibility. And in order to do that, of course, we are providing the best possible advice that we can. For instance, to be able to hug, but hug cautiously, everybody knows what that means. It means outside is better than inside. It means make sure it's in ventilated spaces. It means if you've had the vaccine, and particularly 2 vaccines, then you are safer than if you haven't. And I think it's incumbent on all of us to communicate these messages from our scientists, make sure that people understand them, and I'm pretty sure that the British public gets this, and given how brilliantly people have responded to requests during the pandemic, I'm highly confident that this approach will be successful, and people will be cautious but enjoy the new freedoms that we're thankfully able to give.
Mark Harper.
Thank you, Mr Deputy Speaker. I listened very carefully to what the Secretary of State said in his statement about people being able to prove that they've had the vaccination through the NHS app. And I also listened carefully to what he said about the importance of the union. Can I just draw to his attention something that I hope he can look at urgently, which is I've got thousands of constituents who live in England but are registered with GPs that are registered in Wales and receive their vaccinations in Wales. At the moment, it is not proving possible for them to register with the NHS app that they've had their vaccination. Can I ask him to urgently fix that for my constituents and those across our United Kingdom?
This is another example of where we work better together as one United Kingdom. We are working to solve this problem precisely. Coming from the borders with Wales myself, I understand this very clearly, and so the data work is underway to ensure that there's interoperability between the data systems in England, Wales, Scotland and Northern Ireland. When this situation was not foreseen when health responsibilities were devolved, I've been working with my counterparts in the 3 devolved nations on fixing it. We've agreed to fix it, but getting these data to talk to each other is technically complicated, but it is underway.
Video link. Paul Blomfield.
Thank you, Mr Deputy Speaker. In its decisions on easing the lockdown, the government has rightly emphasised the importance of being driven by data. But when Pakistan and Bangladesh were added to the red list, the data showed that daily infection rates were substantially higher in India. So will the Secretary of State admit that the decision not to put India on the red list at that time was influenced by the Prime Minister's imminent visit to Delhi and the desire to secure a trade deal? And does he now recognise that was a mistake?
Mr Speaker, if I could just explain the data to the Honourable Gentleman, I'm sure that he'll understand. The measures in terms of the case rate per 100,000 are of course influenced by the amount of testing that's done in any country. And there isn't nearly as much testing in Pakistan as there is in India, or indeed as much in Bangladesh. So the measure, as I said in my initial response to his honourable friend on the front bench, the measure of the rate of in terms of positivity of people coming from Pakistan was 3 times higher than the rate of positivity of people coming from India, which was at that time quite low. So you've got to be just careful with the raw data here, and you've got to look at the underlying positivity. One of the advantages of having the testing of everybody at the border is we now have effectively a global surveillance system to understand the positivity of travellers from any individual country. And as I said, the decision was taken on the basis of the fact that the positivity was 3 times higher from Pakistan than from India.
Video link. Mark Logan.
Mr. Deputy Speaker, in Bolton, we're battling the Indian variant, currently standing at 274 per 100,000. The heroes of Bolton jabbed 6,200 people this weekend. Well done to the Health Secretary and his department. Can the Health Secretary also pay tribute to the Bolton team, Councillors Greenhalgh, Baines, Morgan, as well as Dr. Lowy and Dr. Wall? And can the government commit to first dosing the whole of Bolton before the end of May and getting that second dose out to more vulnerable groups at a similar pace? And finally, what would the Health Secretary like to stress to Boltonians as we open up today with the rest of the country?
Secretary of State.
Thank you very much. Mr. Deputy Speaker, there's one other person who the Honourable Gentleman didn't add to the list, probably due to modesty, and that's himself. He has worked incredibly hard over this last few days to get the message out to people across Bolton, and I'm very, very grateful. My message to everybody in Bolton and in Blackburn is take these steps, but please take them safely and get a test and get yourself vaccinated as soon as you're in one of the eligible groups. It is incredibly important that we get vaccinations to anybody over 50 who hasn't had a jab yet. Please come forward now. Anybody over 50 who's had one jab, if that was 8 weeks ago or more, come forward for your second. And crucially, get a test. I also pay tribute to all those he mentioned. Councillor David Greenall, the leader of Bolton Council, has worked incredibly hard too, and his whole team. We're working cohesively together, and I very much hope that with that effort we can get this sorted.
And the next video link, Matt Weston.
Thank you, Mr. Deputy Speaker. Obviously, vaccines are important, but so is testing. 6 months ago to the day, the Health Secretary told us that the UK would open 2 new mega laboratories in early 2021 to double the country's capacity for carrying out COVID-19 tests. We were then advised they'd open in early spring. The one in Scotland was cancelled. The one here in Leamington remains surrounded in secrecy, NDAs and private contracts for staff employed by private companies, some linked to Conservative donors. The Health Secretary will be concerned by the delay, I'm sure, even if he doesn't have a financial concern in this project himself. Can he just tell us what is going on, and can he confirm when the place will open and that staff will actually be employed directly by the NHS?
Thank you very much, Mr. Deputy Speaker. We have a PCR testing capacity in this country of many hundreds of thousands more than we use each day. The Leamington Spa project is incredibly important. People working there are doing a magnificent job, and frankly, I don't think the rest of his question deserves an answer.
James Carledge.
Can I strongly share my right honourable friend's sentiment which he expressed earlier about his pride in the role the United Kingdom has played in the global vaccine effort through the Oxford AstraZeneca vaccine. But of course, the Indian variant has shown us we do remain vulnerable while the virus is rampant abroad. So can you say what further steps we can take in the global fight against COVID?
Yes, Mr. Deputy Speaker, my honourable friend makes an incredibly important point that we cannot stress enough, which is that we all have a role to play, and especially developed countries have a role to play in making sure we get the vaccines around the world. And the UK approach is focused on outcomes, on getting as many people vaccinated globally as possible. And the best way to do that is to allow the work that we've done here, the research and the proving of the Oxford AstraZeneca vaccine, to then be replicated and manufactured everywhere at cost. That is a better approach because it protects the future intellectual property values, and it allows for the research money to go into new vaccines and variant vaccines and doesn't undermine the system of intellectual property, which is the underpinning concept of all pharmaceutical development, yet at the same time it makes sure that we get people vaccinated around the world. And this country should be incredibly proud of the fact that we have helped vaccinate over 400 million people, with many, many hundreds of millions more to come.
Tonia Antoniazzi.
Thank you, Mr Deputy Speaker. On Saturday, my friends and I put on our trainers and walked 26 miles in Goa to raise a bucket load of cash for the fantastic breast cancer charity Walk the Walk. As Chair of the All-Party Parliamentary Group on Cancer, I know only too well the devastating impact the pandemic has had on cancer services. Now, one of the key ways the Secretary of State can help with the government's goals of recovering from the pandemic is ensuring we have enough well-trained and motivated NHS staff now and into the future. Therefore, what discussions has the Secretary of State had with the Treasury to ensure a comprehensive multi-year funding settlement for the NHS in the autumn spending review? And will he meet with me and Macmillan Cancer Support to discuss this urgent matter?
I'm always very happy to meet with the Honourable Lady, and she works incredibly hard on this topic. I'm delighted to say that the recovery of cancer services is going well, and in many of the centres, the rate of both diagnosis and of testing and of surgery is above 100% of 2019 levels. This is very important. Of course, we're working towards the spending review, and the NHS has a long-term baseline settlement. But on top of that, we're putting extra money into the recovery that she rightly champions. I'd be delighted to talk more with her about it.
Richard Graham.
Mr. Speaker, the message today is all about the balance of celebrating the return of more freedoms today and in the future with caution, depending on the good sense of my constituents in Gloucester and elsewhere. Can my right honourable friend confirm how many of those recently hospitalised in Bolton from the new variant had already been vaccinated? Tell us what more we can do to help spread the word to those who haven't yet agreed to be vaccinated, and also confirm what he expects the role of pharmacies in testing to be as we go forward.
Thank you very much. The best understanding that we have is that 5 of the 18 who were in hospital yesterday had been vaccinated once. And 1 had been vaccinated twice, but it's not clear how recently. Therefore, the majority had not been vaccinated. And of them, most of them could have been vaccinated, which is frustrating to see, but is also a message to everyone. We monitor this very, very closely. And the latest information on those who've ended up in hospital, gone into hospital, been admitted to hospital in Bolton over the weekend is similar, that the majority are unvaccinated. So it just reinforces the message that people should come forward and get vaccinated, because that's the best way to protect everybody.
Video link. Rachel Maskell.
Thank you, Mr Deputy Speaker. Prior to Christmas, it was the mutation, the Kent variant, mixed with the opening of the economy in York, which caused a rapid spike of COVID-19 infection as people en masse came to visit our city, and spread the virus to the hospitality sector, where today many of the workers have yet to be vaccinated. But here we are again. A different variant, the Indian variant, and who knows what will come next, with high transmissibility about to be spread. In a city where many people are already visiting, more to come, we feel vulnerable. So what proactive preventative steps will he take so we do not pay that heavy price again for the government not acting fast enough?
Thank you very much. The most important difference between now and then is, of course, that the vast majority of those who are vulnerable to ending up in hospital or dying of COVID have now had 2 vaccines. The uptake rates of the vaccination have been absolutely spectacularly high, and the uptake rate of the second vaccine has also been incredibly high. And this means that the protection afforded to those who have chosen to take up the vaccine is very, very high, with the latest estimates that having had 2 jabs and then waited a fortnight or so after your second jab leads to around a 97% reduction in mortality. Now, of course, we will continue to drive and open up access to find those final few percent of people, but the lesson from the last few days is that if you have not yet taken up that opportunity to be vaccinated, then you should. Because it's those people who have sadly ended up in hospital, and we don't want to see that.
Will Rack. Thank you, Mr. Deputy Speaker. The Health Secretary can be rightly proud of his role in the vaccination programme. And I, of course, welcome the reduction further in age of those eligible. And it may surprise him and indeed the House that, despite my appearance and general manner, there are still a few years yet to go. But I will be there, seized with the importance of taking up that vaccine. But can I urge him to favour that surge of vaccination rather than to even flirt momentarily with the idea of imposing local restrictions, which are neither helpful and indeed bring about a great deal of resentment?
Well, Mr. Speaker, I'm glad to say that we'll get there before the end of July to my honourable friend, no matter how young he is, and because I'm pretty sure he's an adult, and in both actuality and attitude. Crikey, I'm getting myself into more trouble than I anticipated. But his broader point, which is a call against local lockdowns, is one that I understand, and we've had differences of view on this in the past. It is not where we want to go. Of course we don't rule it out, but we have seen the approach that we're taking work. We saw it work in South London, and we have this huge testing capacity that we just didn't have in the autumn. Of hundreds of thousands of tests a day that are available, which is expanding, as the Honourable Member for Leamington Spa articulated. And we have these lateral flow tests, which are simple and easy to use, and you get the result fast, and we've got millions of them. So the surge testing plus the vaccine means that we have so many more tools at our armoury than we did before.